Welcome to Career Explore Northwest Live. My name is Tina Swanek. I'm the Career Explore Northwest educator producer for KSPS PBS Public Television here in Spokane. Thank you for joining us today. Career Explore Northwest Live is an interactive Zoom event that connects young people with professionals so they can learn about careers and career paths. Today we'll be learning about pharmacy technician careers with the help of two special guests from Chaz Health. First of all, Chaz is a nonprofit, federally qualified health center that provides medical, dental, pharmacy, and behavioral health services to families and individuals, regardless of their ability to pay. Chaz has over 20 locations throughout the Inland Northwest. And today we're actually coming to you from Chaz's Southgate Clinic on Spokane South Health. Now to introduce our two guests today. We have two individuals from Chaz, both pharmacy technicians. Nikki Kraus on the left of your screen is a pharmacy technician, but she's also Chaz's training program specialist. And on your right is Mary Collins, a pharmacy technician and graduate of Chaz's pharmacy technician apprenticeship program. Thank you both for being here today to share information about this important and rewarding career and the training provided by Chaz. And now to introduce NewTech. There they are, joining us from the classroom, our students in the pre-pharmacy technician program at NewTech Skills Center and their instructor Shannon Dale. Welcome to NewTech and thank you for joining us today. Okay, before we get started, I want to quickly share the agenda for today's event with you all. First, Nikki and Mary will tell us a little bit about their journey to becoming pharmacy technicians. Nikki will also share how she became a training specialist for the company and a little about Chaz's pharmacy technician apprenticeship program. Mary's going to be telling us about her experience in the apprenticeship program because she's a graduate. Then we'll open the floor to questions from our NewTech students. And because we're a small group, we won't be taking questions through chat today. During the last probably 5 minutes of our event, I'll put a QR code up on the screen for a demographic survey. And this is a voluntary survey that's for our student participants only. So thank you in advance for filling out the survey to the students. Okay, let's get started with our event. Nikki, will you please tell us about your career path to becoming a pharmacy technician, training program specialist, and about Chaz's pharmacy technician apprenticeship program? And Mary, feel free to jump in with your story as well as you go through that process.
Well, thanks for having us. Been to NewTech before. It's a pretty amazing program, so I'm glad you guys got that opportunity. We didn't have a lot of stuff like that back when I was your age. So looking back over my career, when I was your age, I didn't have any idea what I wanted to be. I know when I was a little girl, I wanted to be a teacher. I used to pretend to be a teacher and like head my students and things like that. But as I became in middle school and high school, I was the typical high school student putting in minimal effort, but I did okay. I didn't really know what the next path held. But my family owned a hardware store. And so I did learn a lot of work ethic and I learned how to be a good employee. And so I just kind of kept doing that. As graduation came and went, I just kind of waited to kind of see what I might want to do. I'm a really frugal person, so I had a hard time just jumping into college without knowing what I wanted to do. And I just didn't, I think really the 4 years of college seemed a little daunting when I was your age. So I just kind of waited. About a year after high school, a family friend was a technician and she asked if I'd be interested in doing that. And I hadn't even thought of that before. And all I remember saying and thinking highly of myself was, don't you have to be really smart for that? And she's like, oh no, you can get that. And that's all it took for me. I'm like, well, maybe I'll give it a go. So I reached out to her supervisor and they had a training program. It was kind of quite a bit different than ours. But at the time, you just worked free full time for 6 months, which I remind my apprentices all the time that they have it made because they're paid the whole time. But I did that and ended up really liking it. It's not something I saw myself doing, but I loved kind of the day-to-day tasks that a technician does, and I enjoyed the patient interaction. Something about me is I just love to help. As long as I'm doing something to help other people and working hard, it kind of just fills my bucket of happiness, and so it worked out good for me. It was a clinic setting here in Spokane. I really enjoyed it. Stayed there for several years until after the birth of my second daughter. When she was 1, I was able to fulfill my lifelong goal of being a stay-at-home mom. So I was able to do that, but I kept my license current just in case life threw me curveballs, which of course life does. About 5 years in, and I'm at baby number 4 about this time, my husband started having medical issues. And so it was time to kind of think back of like, okay, I probably should go back to work part-time, which was a really hard decision. My youngest was 2. I wasn't quite ready, but we don't always get to choose that. And so I called my previous supervisor, and ironically, they were hiring a part-time technician, which I don't think they've ever done before or since. So it was a really good opportunity to get back in the workforce and start saving some money, and still kind of get my feet back in the door. I did that for a few years, and life happened again. And my husband had to quit his career as a plumber because his body just wasn't handling it very well, and go back to school full time. So that meant I needed to go full time. And that was a bigger transition to having 4 little ones at home. And so I kind of looked for what might be out there that I can do that was a little closer to home. And I found that Chaz was hiring, ironically, again, right by my hometown. And I was able to get that role. And it was a big blessing because it was close enough that I can still go to all my kids' programs at school and their little parties, and still fill my mom bucket that I valued so much. And it was able to work full time during that. Within about the first year, I was able to be promoted to the pharmacy support supervisor at Chaz, and that's our lead technician role. So I was able to expand on my knowledge in pharmacy. I was able to conduct interviews and hire, and my favorite part is like training the new staff as they come in and just kind of be a good resource for them. Starting a new job is always scary, and so if I could provide that service to make it less scary for them, that made me feel good. And so I did that for quite a long time. I think I was a PSS for a total of 8 years. Along that time, I also added to my role kind of as a clinical technician 1 day a week, where clinical technicians get to work in the medical side. So 1 day a week, I work with a clinical pharmacist. We work with our anti-coag patients, and those are the ones I don't know if you've learned about, but warfarin helps with a blood thinner, but it takes a lot of monitoring. And so I would help room the patients, take their vitals, go over their med list, make sure, see what they're taking and reschedule their appointments. And so that was a fun kind of sneak peek of what else is out there. I did that for several years. And as you get older, like right now, you might not want to learn more, but you end up wanting more and more as you're getting older. You kind of need more. And so I kind of felt like that was me. I needed to grow. I'd been doing pharmacy for a really long time and felt I needed more. So I attempted to go to college online. I only made it through 1 class and realized it wasn't quite the right time yet with still the kids at the house and working full time. So I put that on hold and just kind of look for opportunities to kind of learn more things. The years kind of trickled by, so I don't know time frame wise, but shortly after deciding to wait, our learning and development department was hiring in a new role of clinical trainer for the pharmacy department. So I was able to kind of start that role. And with that, I got to onboard all the new pharmacy staff. I kind of developed the new training for that, which is utilizing the skills I already learned as a PSS. So that was great. I helped with job aids and went to the sites to kind of support the team to see what I can do to help. And I also started overseeing the apprentice program at that time. Back then, we only had about 1 or 2 apprentices once a year, and they worked solely with their preceptor, which is a pharmacist at that site. And I started kind of taking on that. By the end of the year, it had really grown to where we're having more and more apprentices. And so the role split, and we were able to hire a new clinical trainer, and I became the training program specialist, overseeing the program and growing that. Over the last couple of years, it's grown to about 6 to 8 apprentices twice a year in groups called cohorts. And so I help utilize those same skills I learned as a PSS. I interview all the apprentices. I help decide who we might want in the program and hire them. I help train them in their first few weeks, and then they're off to the sites. And I'll talk a little bit more about that in a few minutes. So that's kind of how I became in my role now, and it kind of just gradually worked out. It's not something I ever thought I would do. It just, life kind of just sends you along the way. So what I found is just working hard and just always looking for growing opportunities, even here today. It's definitely out of mine and Mary's comfort zone. And so, but it gives us good opportunities to learn and grow. And our passion is just to help other people to find their passions. And so it's worth the risk. And so one thing that really stands out to me is all the growth that I've gotten over the years. It's just added to the person I am, and I'm able to utilize all the skills along the way. So that's kind of how I became in my role now. And I'm going to go ahead and talk a little bit about our program. I'm going to kind of keep it short, but the main thing we like to talk about is it is a little unique. We don't go off of, it's not a school, so we don't go off of your grade point average or things like that. You're hired on as an employee. So that means you get all the same benefits as an employee here at Chaz. Um, and it's full time working in our pharmacy and it's about a year program. So you get the day-to-day hands-on experience, which is vital, and it really helps you know really right away if this is something that you're going to like. You don't have to go to school for 4 years and find out, oh, I don't even know if I like this anymore. So I find that really helpful for our apprentices that they just know already this is the day-to-day of what it's going to be like. But they're not left to kind of figure it out on their own for academics. We also have a lot of academics. We do a lot of at-home study, but then we come back in our classes a few times a month where we reiterate what they've been learning at home through PowerPoints, interactive activities. Sometimes I have apprentices kind of teach parts of the class, and we have like fun games where I find out just how competitive some of these apprentices are, and that's a lot of fun. Um, and then they have mentors along the way. They have a site preceptor to support them and train them, which is a pharmacist. They have a coach who's a fellow technician that helps them day to day to learn their technician skills. And then I help them throughout the program by teaching. I teach the first half of the courses, all about the different technician things. So patient safety, terminology, pharmacy law, things like that. And then the second half of the program, we have our pharmacists come in and teach how drugs work and like the different systems of the body, which really gives a good foundation for our apprentices to kind of jumpstart as they go into their career and really understand what they're doing. They're not just filling a pill, but like, why are they doing this? How is this helping our patient? And it really helps them get that foundation. So it's like I said, it's about a year program. I think over the course of the last couple of years, I've been able to help 25 apprentices or so, 6 of which just graduated last week. And we had a big graduation ceremony for them where they were able to be recognized for their hard work, because it does take a lot of hard work and dedication to work full time and have school along the side. So they got certificates of completion and awards, and it was really a great night. I have 11 currently right now working towards that goal, and they'll be graduating in 2024. That's kind of, I'm sure I forgot some things, but that's kind of in a nutshell what Chaz has to offer. And I've been really blessed to be able to kind of be a part of their journey to figure out what they want to do with their lives and watch them grow and succeed along the way. And with that, Mary was nice enough to let me not do this on my own. And so Mary's going to share her story a little bit and how she became a pharmacy technician.
Hi, good morning. My name is Mary. Let's see here. I just graduated the apprenticeship this last April of 2023. My journey was similar-ish. I did life a little differently and had children at a very young age. So going to college was something I always wanted to do. I attempted it a few times. It was very difficult for me trying to do that and work full time and have babies at home. So I did work for about 12 years in a hospital setting, just at an entry-level position, not certified in any way. And I loved it for a very long time. I found that I was also craving growth. And in that kind of setting, I couldn't find a whole lot of growth without being certified or having a degree in any way. So I attempted school for a couple of years, found that it was difficult balancing that family and work for me. So at that time, I just had to put it on pause, focus on my family for a bit always, but you know. And a few years later, I wanted to give it a go again because I was just finding myself at a dead end. I definitely loved healthcare. I loved helping people and growing those relationships with patients. I just felt limited and I wanted to know more and do more for them and for myself and family. So I tried going to college again, made it through about 3 semesters, and it was just my family required more of my presence. And I was happy to give it to them. So at that point, I was at peace with where I was. Wanted to find different ways to grow outside of that direction, until one of my coworkers mentioned about an apprenticeship. And I was like, oh, whoa, that's a great idea, because then I can go to work and learn at the same time. So I just started poking holes in the dark, and I took a chance with Chaz. I saw pharmacy, and I don't know why I didn't think about that before. My aunt was a technician, and my mom-in-law is. So I went for it, and I was lucky enough to find myself with Chaz in their apprenticeship. I was placed in a really great clinic. So you have a home clinic. I start out as a pharmacy assistant, thanks. And you just kind of know the minimal ropes of the pharmacy, and then your apprenticeship officially starts. And for me, in my cohort, was about 9 months. With everything, it really equates out to about a year as far as your certifications and getting into the company itself. The support was great. Nikki, as a clinical trainer, was really on top of it. She had a lot of lessons to be able to support folks in their many different learning styles. Yeah, lots of different activities. If you aren't getting it, she's like, hey, what can I do to help you get this? Like, you aren't feeling like you have to struggle to get there. And then in clinic, you have a pharmacist who is your preceptor. They are your person, and I am theirs. And they just take you under their wing and help you, like, with little quizzing throughout the day. We meet once a week to say, hey, or once every 2 weeks. Hey, what are you working on? What do you need help with? How can I help you? Your coworkers and peers, they're just as supportive, because you're going to be their coworker. They want you to succeed, and they want you to be good, so that you guys can work cohesively in the future together. So with that, so anyway, it's a great group. Move along, and you test once a month, and all of the tests are really appropriate as far as the materials go and preparing you for your national test. When it came time to take my PTCB, they gave me adequate study time. I could schedule it on my own time to where I felt like I was comfortable to take it. Had a lot of one-on-one study sessions where I just felt really prepared. And of course, I studied a lot at home. My kids are at an age where they can help me. And it was nerve-wracking. I was scared to take the test. Of course, I passed it fine, successfully. And I found myself proud. And my kids are proud of me, taking that kind of leap out of working for a certain company for 12 years, and then just changing to a new company. You lose seniority, you lose a safety blanket. But I think it was a really eye-opening thing for myself, and for my kids to be able to understand that it's okay to make a change, even if you had a certain goal in mind at a certain time in life. It's okay to change at any time. And some may consider it like late in life, but we won't talk about how old I am. Upon completion of the program, the support never stopped. They were always great, just still checking in. Each group in the clinic, as far as whether it's medical, dental, doctors, pharmacists, coworkers, everybody is so open door and so approachable. Because of course I'm going to still have questions, and they're welcoming questions. They're like, please ask questions. I don't want you to be confused. So it's just really comforting to know that you aren't alone, and you're really guided throughout this whole thing. And success is expected, and it's almost expected that you grow within Chaz. It was, you promote up within. And so I really felt like this was a good opportunity to grow as a career. So found myself in a career. That's success for me. Yeah, I think that's the gist of the program. I'm not sure.
Great. Yeah. Well, thank you so much to both of you for sort of detailing out your different career paths. And it seems like there's quite a bit of flexibility in the pharmacy technician career path for individuals, no matter where you are in your life's journey, which is really wonderful. So thank you for all of that detail and those overviews. So with that, now we're to the question and answer portion of our session today. So I'd love to hear from New Tech if you have somebody there who would like to ask our first question.
What does a typical day look like in the Chaz pharmacy?
Typically, let's see here, we'll come in the morning and we're a team. So there'll be a handful of technicians, depending on the volume of the pharmacy and how busy it is. And then we'll have a few pharmacists, and in the morning we'll meet and huddle and kind of go over the day's game plan. If there's any schedules that are gonna be conflicting in our day, we just let everybody know so that everybody's communicating well, and look at what our priority workflows are, and then from there we just kind of break out into stations. The first station, I call it the first station, is processing. So one technician typically will be typing out prescriptions that come in electronically. So overnight or while a patient is in a visit, the provider's sending over prescriptions electronically. And from there, we're typing it out onto a label for the medication so that it can be legible for the patient to read and understandable as far as directions, the medication and the dose, make sure everything's accurate. At that point, we're billing for insurance claims to cover that medication. And once that all goes through, it is kind of passed off to the second station. So second station is the fill tech. They'll take those prescriptions and print out the label. They'll look for the medication and verify accuracy as far as they're pulling the correct medication, the strength, the dosage, counting out how many tablets are required to fill that regimen, making sure there's accuracy in patient information, and billing and pricing. Put it all together and move on to the pharmacist. So at that point, the pharmacist does their check. I'm sure it goes much more in depth than what I'll cover, but they're looking at the same accuracy as far as patient information, the dosing, the medication, if it's appropriate for the patient, and other medications that they're on, if they're going to be conflicting in that way, if it's going to be safe for them as far as allergies, and again, other medications that they're taking, everything will play a part in their safety. So once that final check goes through, I guess I won't call it final check because there's constant checks going on. Another technician will put it all together. If the patient is there, we'll sell it to them at the register. If they're not there, we'll hang it on the shelf ready for them to pick up. It's reassuring that at each station, everybody's checking for accuracy. So if there was, say, a minor spelling error in the processing, the fill tech is going to catch that. If they aren't able to catch that, the pharmacist is also checking that. The final technician that is taking up the bag is going to check for that. And at the point of sale, we're just finally checking everything again, making sure everything is accurate, because that's important for patient safety and privacy reasons and multiple things. But it's fun, and coworkers, we have a great time. Everybody's respectful. That's one of the number one things I noticed right away. There's zero bad talk about anybody. Everybody's just having a great time, have really good work ethic, and so it's very respectful. Everybody understands. Everybody's there to fulfill the big picture, which is the patient relationship and their safety and happiness. Yeah.
Great, thank you. New Tech, do we have another question for Nikki and Mary?
What is your favorite part about being a pharmacy tech?
I think one of my favorite parts is the patients. So I've only worked for 2 companies in the 25-ish years or so that I've been in pharmacy, and with Chaz it's been 10 years. And so at one site, so I was able to really get to know my patients. And a lot of patients, you see them weekly or at least monthly. A lot of them. So you really build a rapport, and so getting to know them, helping them, uplift their day a little bit, keeping in mind that they're there, a lot of them, because they're not feeling good or, things aren't going the way they were hoping in life sometimes. So if we could be a bright spot for them, that's fulfilling, and put a smile on their face. And usually they're, put a smile on your face too. So I just think just interacting with them and knowing I'm supporting somebody else is fulfilling. So that's my favorite part of being a pharmacy tech.
Next question.
What's your least favorite part about being a pharmacy technician?
I think my least favorite part is that I am still somewhat limited as far as how much I can help them. There's some areas of patient care where it's just not appropriate for me to be helping the patient at my skill level. So it's important to recognize when it's time to pass that off to a higher level of skill, such as a pharmacist or the provider. So with that, it's easy for me to empathize with patients and see where they're at, how they're feeling, and really understand what they're going through and acknowledge that. And because I'm limited, it's important for me to be able to just do everything that I can. Like, maybe I can't help them all the way, but I'm going to do the best that I can in my role to get them to that next step smoothly. Really take care of them in that way. So yeah, I think that's probably my least favorite part. It's I can't do everything for them, which may be unrealistic anyway for anybody.
How has being a pharmacy technician impacted your work-life balance?
For me, like I kind of said earlier, it kind of depends on what type of pharmacy you end up working at, but the ones that I've worked at had really good hours. So I usually work just during the week and an occasional Saturday shift. So I was able to go to their school things. We do get a lot of PTO at Chaz, so I can take time off with them if they were sick or needed me or go on vacation. I kind of like Mary, I think it's helped my kids see me. I share a lot with them, so they see me stressed out last night to come to do this. They see, me trying new things and succeeding or failing. So I think it's good as a parent to just show them a good role model to always keep trying and do your best and help them see a good work ethic. And pharmacy's allowed me to do that, and the flexibility to continually grow has helped me like stay in pharmacy. To be able to transition to these different roles. Each role brought something unique and just added to the person I am. And so I think that gives me a good balance of growth while still making a living for my family and being fulfilled. We can't always do, we need more outside of being a mom, which is usually a big role for us, but it's nice to just have this also so that I do have my own identity and my own good experiences in life, and I cheer them on and they cheer me on, and same with my husband. We just all do it together. So especially with Chaz, it's been able to do that for me throughout these many years.
What is the insurance/billing process?
So I guess I didn't go into it earlier, but so when the prescriptions come over electronically and we're processing those at typing station, that's the point where we're going to bill the insurance for claim to cover that medication. We're able to bill them in real time, and the insurance company is able to also approve or reject those claims in real time. We'll just about every time know immediately why they won't cover. A lot of insurance companies have their own preferences as far as if they will only cover 30 days at a time, and I'm trying to fill for 90 days, then I can go back and adjust their parameters, what they're looking for, and run it for 30 days, and then they'll be like, okay, that's fine, we'll cover that. So yeah, and a lot of times it's helpful, the rejection of the insurance company. It will say, hey, we don't want to cover this medication because the patient's already on this other medication that's conflicting. So that kind of red flags us like, okay, this could be a conflict. Let's dig a little deeper on that and research if this new medication is indeed going to be for them. It can be daunting. It's not the funnest part. But over time, you start to understand different insurance companies and what they're looking for as far as what they will cover. It is ever changing. But it runs a lot smoother over time.
What's the most challenging part of being a pharmacy tech?
I think when you're a new tech, it's probably the rejections and prior auths, just getting to know that. But kind of back to my favorite part was getting to know the patient. So my least favorite part is especially doing the anti-COA clinical tech role, is you do get to know them, and a lot of them aren't healthy. And so you end up losing some of your patients, and that is hard because we're both feelers. And so when you care and serve these people day to day, you develop, bonds, and you care about them. And so when they pass, it's really a hard thing, but it's worth investing yourself in them, and just walking them through those hard times. But it's hard. And I'm sure all healthcare is like that. But pharmacy, you get to know them in a different way than even like the doctor. They see them for a few minutes, they're gone, but we're seeing them a lot. And so you do get to know them a little bit. So that's probably my least favorite.
How often do you get and how often do you manage difficult customers?
Honestly, I worked in the ER for many years. So when I thought about coming into pharmacy, I expected to have a lot of very frustrated, angry patients. And it has been way less. I would say maybe I might get a difficult patient once a day, but it's minimal. And when they are feeling frustrated, difficult, upset, I find the best way to help them in that kind of situation is just to listen. Mm-hmm. When folks are raising their voices, they want to be heard. Or when they're frustrated and expressing that to you, like they want you to know what they're going through. And so just acknowledging that, using acknowledging statements such as, hey, I understand what you're going through. I'm really sorry that this is happening to you. Different things like that. Also, they're looking for a solution. I may not be able to provide that solution to them right at that moment or even that day, but I at least want to let them know what I can do and set the proper expectation as far as how long it could take to have a resolve and the parties that will be involved. And that's just like another piece of the puzzle, just having some education behind how things work usually calms folks down. Because if you're confused and you're like, I don't know why this is happening or what's going on, if you kind of educate them about how it happens, and then they're like, oh, okay, I understand. Now I get why it's going to take a couple days for this and that. So it's just really good to be patient, calming voice, like low tone, clear, and yeah, important to keep your own attitude positive. And
try not to take it too seriously.
Yeah. It's hard not to take it personally, but just know that they aren't mad at you. They're upset with what they're going through, and so it's important to empathize with them on that. Yeah.
What is something you were taught as a pharmacy technician but haven't had to utilize yet?
There again, it will depend on where you're at. Since I worked in clinics, like hospital or compounding things we were taught, and I know the program goes over a lot. So the technicians that stay with CHAZ might not see those as often, but it's still good groundwork to still understand how things work, because you never know where life's going to take you. You might find yourself at a hospital setting or a compounding pharmacy. And as CHAZ continues to grow, we have all sorts of kinds of pharmacies. So just having that knowledge is helpful. But I know I crammed for the PTCB to learn drip rate, and I got it down, and they never even asked me. So that was frustrating, but I'm glad I don't have to do it all the time. But I was proud that I learned it.
What is something that you still want to know as a pharmacy tech?
I think daily I want to know more about the medication itself, more about the drug itself. I do process and fill a lot of HIV medications. I haven't given myself the opportunity to really dig deep on how those medications work and how well they're providing a service to our patients. I think by knowing that, I could answer patient questions a lot more. I could understand where they're at and kind of find myself at their level also. So I think that would probably be the main answer to that. It's just knowing more about the drugs in general. And new drugs are coming out all the time. So it's really a never ending learning curve, which is important for me. I don't want to be sedentary at all in my knowledge. It's more entertaining in a career when you're always learning and growing. It's definitely fulfilling that matter.
Knowing what you know now, is there any reason you would not be a pharmacy tech right now?
For me, it's really worked out great for considering I had no idea what I wanted to be. Looking back, I think I was just reflecting on this earlier this year, to that little childhood dream of being a teacher. And ironically, somehow life just ended up being where now I get to be that teacher that I always wanted to be. So that was kind of fun. But as I onboard staff when I was the clinical trainer, I could hear different things that sometimes were hard as they were onboarding and were excited to work with us. But I think it will just depend on the environment. So if it's a career that you might want to do, just doing your research and getting to know your personality type, do you want to work with patients up close, or do you want to work like a compounding pharmacy where there's not as much patient interaction? Do you like a really busy pharmacy like retail, or do you want to do like a clinic setting where you might have more of an opportunity to get in their charts and to help find out why something's taking longer, or so just getting to know your role. So I feel like that sometimes technicians get frustrated with that. I've always been lucky to just work in the 2 clinic settings, so it's those I find very rewarding. But I think that's been one that I've seen the most, or growth. But like you've seen, there's always room to grow. Even the day-to-day gets kind of mundane in a certain way. But if you have the mindset of, like Mary, always wanting to learn, then there's always new things to grow and become as you continue on your career. So for me, and I think for Mary as well, it's been a blessing.
Yes, I agree. And just coming into it, I had no idea. There are so many different roles that you can be in pharmacy as just a technician. I didn't even imagine. Pretty well, you aren't limited. You aren't just limited to that fill tech at that pharmacy. Like there's a lot. There's so much.
Are there any more questions from New Tech?
No.
All done? Great, thank you. Nikki and Mary, is there anything else you'd like to tell us about pharmacy technician careers or Chaz's training program?
A few things that I guess we're always trained to impart wisdom is, I guess if we were your age again, just making sure that what we found helpful is just always being engaged, even if you're in a role that you don't like, this job that's like, I'm never going to stay here, I don't like it. You can kind of make the best of any job. And if you have that mindset to just learn how to work hard and do the best in any role, then you'll be successful in life. And so I think that's benefited me over the years. And then also not to let fear or unknown kind of hold you back. I don't know if any of you guys, some people already know what they want to be, which would have been really great. Some still don't know. I mean, who knows what's out there for me now, but being willing to do the research like this, what we're doing today, they have a lot of resources out there. You probably will never have more time in your life than now. So take the time to research what's out there. When you talk to other people, what do they do? What do they like about it? Don't just look for a paycheck. When you're doing something day to day, it needs to be rewarding and fulfilling if you want to stick with it. So don't be afraid to just take a jump and know that I have young adults and teenagers of my own, and it could be daunting. Like, what do I want to do with the rest of my life? I think that's always a good goal, but you're maybe not like, I didn't know I would be doing this. So just what do I want to be doing in the near future, and then just let it roll. Don't put the pressure on yourself that you just have to have it figured out right now. If you can see by both of us, we're still figuring it out. So you just kind of just work hard and research, and things will work out.
I agree. And as you mentioned, even if you're in a position or a job that you don't feel like you'll be at forever, you're just filling a role. Keep the attitude that you're gaining skills. Like, honestly, I am applying skills from my very first job, fast food, to my current position. I know that sounds silly, but just understand that anywhere that you are, you're putting more skills in your toolbox, and you're going to carry those forever. And that goes also for the folks that you interact with. Like, every day is an interview. You have no idea who you are talking to or how they might be able to help you in the future, and vice versa. So I think it's just important to always be positive and understanding that each step of the way you are benefiting.
And as far as like hiring, I think that's one of the hardest things in my role now. I want to give everyone a job, but currently we can't hire 40 people at a time. And so trying to weed it down, we can teach you the knowledge and the skills to be a technician, but to have a good, strong work ethic, to be punctual, to take your job seriously, to be a team player, all those things you can be doing at school now, in college if you go, any job that you're doing now, it does give you a leg up, because that can't be taught, that strong work ethic, and it's lacking more now in days. So I look for people like that, and the people that care. That can't be taught as well. You have to be a caring, a compassionate person in today's world is really important, and that will get you a long way as well. So those are the things I look at. It is a competitive program. On average, I have 45 or so applications for the 6 to 8 row application or spots that I fill each time. And so it's not a fail safe that you'll get it, but just being yourself. We require a letter of reference, a resume, and then 3 essay questions when we have our apprentices apply. It helps us get to know them better. And so if down the road this is something that you might be interested in, just be yourself in any job that you're applying to. Nobody wants to hire someone and then come to find out that they're not that person. So just be honest and true to who you are, and you'll find the right fit.
Great. Thank you so much to both of you. If there are no more questions and nothing else that you'd like to share, Nikki and Mary, I think we've reached the end of this Career Explore Northwest Live event. Again, thank you so much to Nikki and Mary from Chaz for making time to visit with us today. We're so thankful for the information and the insight that you've shared with us about pharmacy technician careers, and your individual journeys are so interesting, especially how you've taken advantage of opportunities as they've arose for you, which I think is really something that happens to all of us in our career path. Thank you to Shannon Dale and her wonderful students at New Tech for participating today and asking some really great, thoughtful questions. We're so thankful that you were here with us today, and we hope you got a lot of great information out of this session. So that concludes our Career Explore Northwest Live event. And thanks again, everyone, for joining us today.
Thank you.
Thank you.
Thank you.